Tobacco is a drug.
It's a gateway, it's a Pandora's box.
Hey, the most painful thing is the mental breakdown of a child.
So I think we're underestimating the informal sector to assume that they won't make money.
Tobacco industry court cases, they always lose.
Tobacco does not have safe level of consumption.
First, the main concern should be the health of the people.
The Anti-Tobacco Network is a non-governmental organization that was established in 2011. And the Anti-Tobacco Network was established for the simple reason of assisting the government of Botswana to do its job, to protect public health. The government of Botswana signed and ratified a convention called the Framework Convention on Tobacco Control. And this convention requires that countries must come up with laws that will fully protect people from the harms caused by tobacco.
That 17.6% translates to 240,000 of Botswana who use tobacco, either smoking or smokeless.
Tobacco use most commonly leads to lung diseases. And we know that with COVID, that's the area that it attacks most. And also it causes various cancers. And with tobacco use, there will be the chances of lower respiratory infections are higher. And it also increases the risk of recurrent TB and impairs response to treatment. Tobacco kills about 22 men every week in Botswana.
These are not just numbers.
My name is Boyson Mukone. I'm 43 years old. So there was a time when we had to have a break. We went off stage, and there was a guy, a friend, but not that friend, a guy who was like, whoa, Rude Boy, you are the guy, man. I was called Rude Boy by then, that was my stage name. Rude Boy, you are the man, man. Do you know what? If you could have 2 puffs on this cigarette, man, you are gonna have the power to do this and that and that.
Addiction is a disease, and we define it as a chronic relapsing disease that is characterized by the persistent seeking and use of drugs or substances despite harmful consequences. Addiction hijacks the reward system of the brain. It actually hijacks the natural chemicals of the brains, and they are produced more than usual. The chemical of note here is dopamine, which increases when you are using substances and actually gives the pleasurable effect of substances. Tobacco is a drug, and the active ingredient in tobacco is nicotine, which we know that is a psychoactive substance. A psychoactive substance is a substance that affects the brain and the neurological system. Nicotine does that. It is classified as a stimulant. It stimulates the nervous system. It's along the same class of drugs as cocaine, for example.
And when I was with my friends, we were the classic ones. It was so good now because I had the people that You know, we were a group that accepted each other. So it was easy and fair enough for us to share our friendship through whatever that we were doing, more especially smoking.
Because of their peers, they end up following this habit of smoking because they think by smoking one becomes, an important person. I don't know why people want to associate smoking with dignity.
But I didn't know actually that, do you know what? That was a step that was driving me to more harder drugs.
We talk of gateway drugs, which is that when you use certain drugs, they prime you, or you are more likely to then use other addictive drugs, usually stronger addictive drugs. Research has shown that people who use tobacco are more likely to use cocaine. Actually, when we do studies in people who are using cocaine, as adults, about 90% of them started off using tobacco.
So I started smoking weed. From weed, I started getting introduced to ecstasy.
From the numbers that we're getting from the police, that there seems to be an increase now in the use of harder substances.
The convention recognizes that the tobacco industry markets very lethal products. And so governments have got the responsibility to protect the public from consuming such. And so just like you will regulate liquor sales, just like you will regulate speed of the traffic speed, anything, just like anything, you have to also regulate tobacco on account of its harms.
13% of Botswana aged 15 years and above, they are exposed to tobacco smoke at indoor places like at the workplaces. Around 12% are exposed to tobacco smoke at homes.
So the person who is inhaling passive smoking is inhaling without any filter. And so they're exposed to some of these other residues apart from the nicotine that are actually very harmful in themselves. So that is why some research shows that passive smoking is actually much more dangerous than smoking itself.
If a person chooses to affect his own health, let it be him and him alone, or her and her alone.
You choose when to smoke, isn't it? You do. You choose that I'm going to have a cigarette now. A person who works in a restaurant does not choose when they are going to have that cigarette that you are going to offer them through your tobacco smoke, your cigarette smoke. If they work 8 hours, they're going to be smoking that for 8 hours.
Yes, and yes, indeed, because you are exposed to the drug when you are, be it passively, you still can develop addiction from that and end up picking the habit yourself, because you still will have the same effect on the brain that the person who is smoking has, especially if you are repeatedly exposed to the smoking.
It is so painful. I wish we could have it also applying to vehicles, because I've seen parents with children in a car, windows closed, smoking.
Let us not talk about the rights of the smokers at the exclusion of the rights of the non-smokers.
let the people know what tobacco contains. And therefore, that's why it requires that countries must come up with legislation that clearly the products that are containing tobacco, like the packaging, must have clear messages. If you look at the messaging right now, is that you have this big pack, and then you've got this small font that you have to look at to check what tobacco can do to you.
The tobacco industry, they're most likely to use these colorful, they're slim, slender ladies holding these long, slim cigarettes, in a way to attract people.
It is called deceptive marketing. The packs of cigarettes are going to have large pictorial warnings, and they are saying up to 70% large of ugly, because it will be showing the true picture of when you smoke, you will not look good.
Again, there is evidence, plenty of evidence that shows that advertising promotes the early initiation in smoking.
Young people, because their brains are still developing and their personalities are still developing, they don't have as much wisdom as older people do. So they are easier to influence than somebody who is more mature, whose thinking has matured and is more rational.
We don't want to make a deadly product attractive.
The current law is doing what is called reducing access.
Tobacco does not have safe level of consumption.
Even one cigarette will harm a person.
.9% of Botswana, they buy single stick of cigarettes from street vendors.
Some of the street vendors, they are placed next to schools. Not all of them, of course, but most of them are placed next to schools. And this makes students in particular vulnerable.
As we were doing this survey, the Global Adult Tobacco Survey, we realized that most of the youngsters are the ones who buy these single sticks from the street vending.
The industry started to even make small packs of the sale of single cigarettes, because a child will come and buy a single cigarette. They made a small, beautiful pack which has got matchsticks inside. When I buy a cigarette, they'll then insert the cigarettes inside and then go back to school. And what did the kids do? They sell to other kids.
The younger you start using the substance, the more likely that you become addicted quicker, and the more likely that the addiction that you develop is going to be much more severe, which means it's going to be very difficult for you to stop using the substance in future.
Whereas if you say you are going to be selling cigarettes in packs of 20, that child will not afford to buy that pack of cigarettes. Licensing and how much cigarettes you sell in packs go together, because then when you license, you are saying who can sell and where can they sell. Because somebody was saying it doesn't matter, even if you say you ban the sale of cigarettes, kids are going to contribute money and they will buy a pack of 20 cigarettes and they'll divide it among themselves. Now here's the issue. Kids will not get the cigarettes anyway, just like they cannot get alcohol anyway, because you license alcohol.
There's no quantitative verifiable data that points to the amount of money that the tobacco industry contributes, and the amount of money that comes in is through import taxes, import duties, and obviously other profits that are made within the retail sector. I don't think that we can fairly compare Botswana's tobacco industry to other countries that are proactively manufacturing or producing tobacco and having a whole entire value chain that's based on tobacco from raw material stage up until selling and distributing it to other channels. So I think if we were to compare it, Botswana's tobacco industry would be fairly very small.
They are going to tell you, Hore, cigarette smoking, Ghana, a smoker is the one who is bringing money to a parent who is a single mother so that they could feed their children and what. We understand the story, but there are so many ways of feeding your children. Do you mean that for your child to survive is when you give another woman's child poison to eat?
Do the people, like for instance the vendors, are they most likely to make profit from tobacco than all other products? There are all other products that can be sold to promote business.
The law that is coming is trying to actually make sure that the tobacco industry does not interfere in policy making that is related to public health.
People are assuming that the informal sector is going to be cut off from the chain that has been benefiting of selling single stick cigarettes, and I think that's completely unwarranted, because policy is not blind to the realities that exist on the ground, and especially for a tobacco policy that has been so well thought.
And this law has got those provisions that one, government cannot partner with the tobacco industry. That two, government should not make any special considerations for the tobacco industry because they have got different interests.
So I think we're underestimating the informal sector to assume that they won't make money when single stick cigarette sales are prohibited.
The cost to life can never be matched to any other cost. Life is too precious. Life is too expensive.
But I never took heed of that until when I woke at Princess Marina Hospital on my deathbed.
$447 million annually is used to dealing or tackling conditions attached or linked to tobacco.
And I think for a small country like Botswana, we should be alarmed at the amount of money that the health sector spends in treating people who take part in smoking.
Indirect costs is loss of productivity due to illnesses linked to tobacco use.
Even at work, they knew that at times I would never come to work 1, 2, 3, 4, 5, 6, 7 days.
And the employer has invested so much money in that employee through training, everything.
I lost my job at Department of Road Transport and Safety.
A single person dying is a cost, a big cost.
I was once in jail. I became a young father. I nearly died.
Hey, the most painful thing is the mental breakdown of a child. When a parent brings up a child who graduates from secondary level education, goes to university, but is not able to complete his studies because of drug abuse.
The beauty of the current act is this. It recognizes that there are those people who smoke that need help.
I would tell myself, do you know what? this is the last puff and this is the last pill I pop.
Around 83% of Botswana who are willing to quit it. The study has revealed that around 58% of Botswana, they made an attempt on their own to quit tobacco. And finally, only 7% of the 83% managed to quit.
Looking now with COVID, you see that our health system is overwhelmed. It's not only COVID, there are other conditions that we need to treat. So in terms of manpower, in terms of equipment, in terms of medication, we can never have enough resources to treat smoking.
It's really a direction where we should be moving in having more accessible treatment for people with addiction, because the problem is huge out there. Once you realize that you are hooked to the substance, as soon as you possibly can, try and seek help. People who seek help and are assisted by health professionals have a better chance of quitting than those people who try and do it themselves.
So it's not just a law that is there to punish people who smoke. It's a law also that is going to take care of people who want to quit to smoke.
To be seen on the high tower. I'm a living testimony. I sing this songs of glory. That's why every day, every time I'm trying to be just so holy. It's gonna be you coming up again, but the remedy is never too late, never too late. I wanna maybe come to a just game, but the road to
Never at any given point to start smoking a cigarette, because it's a gateway, it's a Pandora's box of all the bad elements that we have ever come across in life.
Addiction, in our experience as frontline healthcare workers who see patients on a day-to-day basis, is the next epidemic in this country.
And it's not always one way. It's not always a one-way street. I think that with this incoming regulation, the government can always find other avenues to create more revenue from the industry, other than just it being restricted to the informal sector.
Those who want to continue to smoke will continue to smoke. No one is going to stop them. But those who do not want to smoke or do not want to be exposed to tobacco smoke, they will be protected.
First, the main concern should be the health of the people. That is the main concern.
So no one is saying ban tobacco. This whole thing of banning tobacco, people are going to lose jobs, it's all fallacy. No one is saying that. The law is not saying that. The law is saying control, regulate. That's all. Just like we are regulating everything else. That's the bottom line.